privileged to welcome you to the 8th edition of the Nigeria Implementation Science Alliance Conference on Bridging the Implementation Science Gap, Strategies for Successful Translation of Evidence into Practice. First and foremost, I would like to express my gratitude to all the attendees who have traveled within and outside Nigeria to be part of this gathering.
We are very excited to receive everyone today. I'm really so honored. Ekis is so honored to be the host of this very important conference. I want to welcome our former minister, Professor Adewale, and our colleagues from the US who came for the conference, for the council conference, colleagues from PEPFAR. I see Dr. Helena, I see Fumi. I have the pleasure of really bringing this important session, which we know has been a major issue, bridging the gap, like we've put it. And we do know that evidence is so vital to policy, but how much has that happened in our countries?
Your presence here today reaffirms our collective commitment to advancing implementation science and exploring innovative pathways towards improving healthcare outcomes in Nigeria.
You're going to remember Nigeria, you're going to remember Ghana. These are countries that are in West Africa, and there are a lot of Francophone countries that are in Africa, but in West Africa. But we haven't really contributed much into the military. We have done a lot of implementation because Nigeria population is 1/5 of those African countries. But we have done a lot of implementation, but little. So if you go to the shelf of many programs in Nigeria, you can actually write 20 publications from their friends. And I can assure you here, if you move from one IP to IP, the data they have, if you move to CDC, to USID, to DOD, the data they have will be 20 things that are still lying on the shelf, not published, not shared, not grasped.
For you to be able to understand even the research that is out there and apply it to clinical practice, which most of us do every day, you need to be able to understand the data, understand how to interpret the data, and also be able to see how your current implementation is different from what has been described in literature.
Policymakers are not carried along. They don't even know what is actually happening, and so why you actually want to blame the policymakers on the other side. Even the researchers, they have their own different perception of what research is all about. So what I will call our attention, the researchers that we have here and even the future researchers, if we are embarking on research, what is actually needed is we should actually base our researches on things that are actually the problems of the country and those issues that are of interest.
And so, through evidence that we have generated since 2006, giving visibility and a voice to this subpopulation, we have, used the first study, which was conducted, to provide the tools and strategies for the first integrated biobehavioral surveillance survey, the IBBSS, that was conducted, the first one that was conducted in 2010 at that time, and we built on that evidence over time to where we are today. And through that evidence, we have built, not just evidence, but also strategies and interventions, to mitigate the sufferings, that this population suffer from.
I think one criticism but opportunity that we've heard
from PEPFAR is that oftentimes the communities that are actively involved in generating the data may not be carried along when it's published, or you may not see them represented in, the names and the abstracts, so they're not going to the IASs or the ACASAs. And so that feedback loop, that communication, that engagement of sharing that information is going to be critical to ensure that that information, that evidence that's generated, when we talk about application and knowledge transfer, really truly cross-pollinates, especially here in Nigeria.
Data science, new methods, whether that is mathematical modeling, network analysis, genetic analysis, these are all things that are being built and are absolutely transferable. So once again, thinking about the trade-offs, these capacity building skills, it seems like it's worthwhile to invest because they will be able to.
Now, the other aspect is, we have the National Health Insurance Authority. The name has been modified to authority. So we have strengthened the community-based HIS or health insurance scheme, and also strengthen the other non-formal health insurance scheme. So as a country, in terms of health financing, I think we are much better.
Thank you very much. Thank you for having me here today. I really speaking from my experience previously working as country director for Resolve to Save Lives, where we worked very closely with the Nigeria Center for Disease Control around preparedness and response, and also working with the Nigeria Federal Ministry of Health on hypertension and general control of NCDs.
And having had a hand in training a lot of healthcare workers, both lay healthcare workers and facility-based or professional healthcare workers, that's what we could mobilize and leverage for service delivery that was related to Ebola, although Ebola was on a more limited, thankfully, more limited spread in Nigeria versus COVID-19.
To identify determinants and strategies for cervical cancer control, and that went into our formulation of our grant proposal. So we actually did that prior to the grant proposal to identify these barriers so we could come in with some strategies already set. But that process engaged stakeholders across different parts of Nigeria.
I think that it's important to hear the successes, and the successes they shared were not, oh, we wrote this many papers, oh, we sent this many people to conferences. The successes you mentioned are lives saved, right? Through addressing postpartum hemorrhage, through identifying babies who were at risk for transmission. So I think that alone, for me, makes it worth trying to find a way.